Dee, if you'll hand out that thing. One of the things that we're working on now, I mean, I think all of you know that there are really good reasons to do cesareans, and I think the ironic thing was that, again, about 40 years ago when I was a resident, the first public scientific paper I gave was an argument to increase the cesarean rate, which was at 4% at the time, because we were dragging out very large breaches and they were getting cerebral palsy and things like that. So there were some good reasons to raise the cesarean rate. And nobody, the studies really haven't been done, and maybe they never will be, to tell us exactly what the healthy rate should be. Our national goal is 15%, and that's based on the World Health Organization. But American doctors look at that and say, well, that's other countries, it's not us. And I would think that, especially with the obesity epidemic and some of the chronic disease problems that we're seeing, like diabetes, it probably should be between 15 and 20%, maybe around 20%. I think you could use Shands, Jacksonville as a really good bellwether of the way it ought to be, because they get great outcomes, and in a high-risk population. I'd like to look, so what we're doing is, one of the things we've realized is that, especially with a number of the things that are happening causing this, and as you look into it, the docs will say, well, it's malpractice. Nobody ever gets sued for doing a cesarean, but you get sued if you don't do them. Well, I'm having lawyers call me now, and I don't get involved in those cases, but saying, we want you to come and be an expert witness because somebody did a cesarean without labor and they got a 3.5-pound baby that has cerebral palsy or is developing poorly. And one of the reasons that that's a concern, I hope all of you have seen this, but this is the March of Dimes came out about 6 months ago with what's called the brain card. And your brain at 35 weeks doesn't have any folds in it or sulci, which is what makes you develop and think. At 40 weeks, you got lots of them. I'll pass that around, and you can keep that. But so the Coalition for Improving Maternity Service, KIMS, which I hope some of you belong to, and March of Dimes in Florida have decided that we're going to take a shot at coming up with really true informed consent forms. And so you're going to be part of this project. You're les pigs de Guinea tonight. And so I want your feedback on this because, and what we're thinking is that, if people are going straight from pregnancy to a cesarean with no labor, what are they being told? And as we talk to some of those people, they're not being told very much about the bad parts of that. They're being told a lot of good stuff. You can schedule your baby, your mom can get here on time, you won't have the pain of labor, a few things being left out there. So, huh?
Save your perineum.
Yeah, save your perineum so your husband will be happy. The other controversy that comes up is that women all over the place are asking for cesareans. And our good friend Jean DeClercq up at Boston University does the big national studies every couple of years on listening to mothers, which I hope you also know about. It's on Childbirth Connection. He works with them. But the National Institutes of Health had a big conference in 2006 about cesarean on maternal request. And a bunch of us went to that. And the first thing we ask is, well, this is NIH, what's your scientific research? And they said, oh, we don't have any. We've just heard that this is really happening. We thought we ought to talk about it. And every time we ask NIH to do a study on what the cesarean rate ought to be, they say, well, that's too expensive. It would take too many years and be too difficult. So what gene studies show are that less than 0.5% of women ever come up with the idea on their own that they should go straight to a cesarean, and these are normal women we're talking about, not women with serious problems that need a cesarean. And yet that's out there in the press and unfortunately in women's magazines, that it's the boutique thing to do, you know, is to go in like Britney Spears, who's a great role model, by the way. So I don't complain about her, because, you know, if all American girls were like her, we'd be in great shape. So at any rate, what we're doing is drafting informed consent forms that, and the idea we have is that they'd be given, and there'd be one for cesarean, one for VBAC, one for epidural, which has its problems, and one for, what am I leaving out? Induction. Thank you. Exactly. Because a lot of inductions that are occurring, you know, almost always lead to cesareans because they're not really inductions of labor. Nobody ever really gets into labor. So there'll be 4 sets of national consent forms that we hope to get the March of Dimes to agree to distribute under their okay. And then with it, KIMS has already has committees developing brochures that go along with the informed consent form. So the informed consent form would be as short as we can possibly make it, so it's not a bunch of blah blah. And then to answer your questions, you go refer back to the KIMS accompanying handout. So this is first draft of a part of an informed consent form. The other idea is to give those 4 informed consent forms out prenatally in a staggered way. Starting at 26 weeks, you might get induction of labor. Next, 2 weeks later or 4 weeks later, you get another one, so that by the time you were 32 weeks, you and your significant other would have had a chance to read them at home, write down the list that you both read and understood them, bring them back to the doctor or the midwife, and have a good discussion about the various points. And so as you're looking through the list with me here, just ask me any questions about it, but I'll go down it with you. But if you've had a pregnancy, start thinking, did people really tell me about this? You know, in a way that not in the heat of battle, not while I was, at the top of a contraction and wishing that, I was a man. And the part that's left out here is that we will put a thing up there saying, I understand that I'm being advised to have a cesarean for the following reasons. And then the doctor or the midwife would write in there what the problem is. And then what the advantages of that are. That would just be written in. And that could be saved till the end.